So the goals for the ambulatory practice of the future have been, most importantly, to engage patients in participating in their health in a way that perhaps is more effective than we could be in traditional practice, where we really devote a lot of time to engaging them in conversations about their care, setting goals for their care, coaching them, and maintaining very close connections with them, which we do not just through office visits, but through what we call virtual care, through scheduled phone calls and telemedicine encounters, through email, and hopefully we'll be exploring other ways to use technology to stay connected. Our mission also is to enhance and improve the lives of physicians and other providers and staff that work in primary care and ambulatory care practices. So we've thought a lot about how we develop a team, how we create a healthy culture, how we really work together as a team to support each other, how we engineer the day to allow more time to do the things that need to be done. And we're hopeful that payment schemes of the future will support that kind of care, and that's really also what we're exploring here. In a large self-insured environment, we're able to really tinker and understand where there's value not just in face-to-face encounters in the office, which is really all we traditionally pay for, but in these virtual encounters, in devoting time as a team to developing protocols to manage illness, in training to take on more activity that traditionally the physician had to do, in thinking about populations of patients when they're not with us, reaching out to follow up. All of that has value, and so and much of it can be supported by technology that ultimately may have a cost but would help to reduce the overall cost, medical cost of a population. So again, the work life and the satisfaction is a big part of the mission here. In addition, we're very interested in showing students and medical residents, primary care residents, that this is a good option for their future, for their career, and that it's a sustainable career path, and that they can provide the kind of care and have the kind of encounters with patients that they want to have, and not worry as much about burning out, which has been a concern for many clinicians. And again, enjoy the rewards of forming long-term relationships with patients, but be supported to really provide the kind of proactive care that needs to be provided to improve the health of a population and of each patient.
Yeah. Can you describe a little bit team-centered care and how it differs, I guess, from a traditional approach to?
Sure. Yeah, team-centered care requires a lot of investment in the development of roles and of the team, and that means development of relationships and coordination of care. So team-centered care is about starting the day together in a huddle and understanding what's the work of the day and how do we share that work. How do we develop each role to be able to take on the appropriate work that they should be doing, and maybe even to go a little further. So developing professionally to help each member of the team feel rewarded and feel like a vital member of the care team. It's about communication, so it's really understanding how to share the important information about each patient so that the team is up to date and the patient should see that. And it's about maintaining a healthy culture, so addressing issues as they arise, feeling empowered across the team to sort of communicate about problems or concerns, and to feel empowered also, each member of the team, to improve the processes and the care that we provide. And so that's really what team-centered care should be about. It takes a lot of work, and it's a lot of the time and effort that we invest here at the APF, which is to be together as a team. We have a weekly staff meeting. We have, again, daily huddles. We provide a lot of opportunity for interaction and communication in the space that we've designed, that you'll see and hopefully in the pictures that have been taken of our space. And that's important. So I'll leave it at that.
How many members are on a typical team?
Yeah, a typical care team here consists of a physician and a nurse practitioner, a nurse, a medical assistant, and a coach. Ultimately, there'll be 3 teams here at the Ambulatory Practice of the Future that have a core clinical group that I've described. There's also a medical secretary, a greeter. We expect we may grow the administrative support as well. In a sense, it's all one big team sharing their resources and skills across each patient panel, but we're forming, we believe, 3 patient panels of about 2,500 patients each. Perhaps more. We'll see if we can accommodate more as we grow. But that describes the team.